Welcome to EPG Pathshala on the subject Social Medicine and Community Health. I am Dr. Vidya-mitra, Professor in the Department of Community Medicine at Institute of Medical Sciences, Banaras University. I shall be discussing the module National Tobacco Control Program, which belongs to the paper National Tobacco Health Programs and Policies. This module has been developed by a team comprising of myself, Dr. Devendra Kumar Taneja, Dr. Sakya and Dr. Bhatati Banerjee from Delhi. The learning objectives that has been set for this session is that after going through this session, one should be able to understand the harms caused by the use of tobacco, to know the global effort for tobacco control, and one should know the various initiatives taken by Government of India to control tobacco use in the country, and to learn the important provisions made under Cigarette and Other Tobacco Products Act 2003. Last but not least, to learn the organization activities of National Tobacco Control Program. We all know that tobacco consumption is quite high in our country, and it is associated with many health hazards and social hazards also. There are several prevailing myths about tobacco, and that is why its consumption has been at a very larger scale. The myth is that consumption of tobacco leads to concentration in studies. Another myth is that it keeps GI tract quite functional. So these and other myths are that it improves scholastic performance. These several myths are prevailing in the society, and that needs to be curbed. The problems associated with tobacco consumption can be appreciated by that the quantum of consumption prevailing in our country. India is the second largest consumer of tobacco in the world, second only to the China. Tobacco use is a risk factor for 6 of the 8 leading causes of death in the world. Globally, 5% of all deaths from communicable diseases and 14% of all deaths from non-communicable diseases among adults aged 30 years and over are attributed to tobacco. Inhaling second-hand smoke causes lung cancer and coronary heart disease in non-smoking adults. The point that should be noted that it is not only health hazard for the people who are consuming tobacco, but people living in close to the people who tobacco consumers are also at enhanced risk. Nearly 8 to 9 lakhs people die every year in India due to diseases related to tobacco use. Nearly 30% of cancers in India are related to tobacco use. Tobacco use by pregnant women leads to low birth weight of babies, premature deliveries, stillbirths, and birth defects. Point that should be noted that low birth weight is quite prevalent in our country. Nearly 50% of cancers in male and 25% in female in India, and more than 80% of all oral cancers are directly attributed to tobacco use. So one can understand the quantum of problem created by just tobacco use in terms of cancer in our country. Global initiatives for tobacco control. A framework convention on tobacco control, popularly known as FCTC, was adopted by World Health Assembly on 21st May 2003. Government of India ratified the WHO Convention on Tobacco Control in February 2004. The World Health Organization Framework Convention on Tobacco Control lists some of key strategies for reduction in demand and supply of tobacco to be adopted by the international community. Demand reduction measures include price and non-price measures. Supply reduction measures include elimination of illicit trade, prohibition of sales of tobacco products to and by minors, and provision of support to tobacco workers and farmers. World Health Organization introduced 6 M-Power acronym package in the year 2008. M means monitor tobacco use, so that we can understand whether the problem is rising or declining. Protect people from tobacco smoke, both direct and indirect form. Offer help to quit tobacco. Warn against dangers of use. Enforce ban on advertisement, promotion and sponsorship. raise taxes. So these 6 M-power strategy can pay dividend in the initiatives of tobacco control. Tobacco control initiatives in India: Prevention of Tobacco Adulteration Act, Amendment 1990, has enforced statutory warning regarding harmful health effects, and it was mandatory for pan masala and chewing tobacco also. Drugs and Cosmetic Act, use of tobacco in all dental products was banned. Global Youth Tobacco Survey 2009 identified that 14.6% of youth consumed some form of tobacco. Exposure to second-hand smoke in their homes was quite high, 21.9%. And as I have said earlier, that tobacco direct consumption and exposure to second-hand smoke is equally harmful. 26.4% have one or the more parents who smoke. So there is a prevailing environment which promotes smoking at family level. Global Adult Tobacco Survey, India 2010, nearly 35% of the population, adult population, consumes one or the other form of tobacco. Tobacco control initiatives in India. The most famous Act, Cigarettes and Other Tobacco Product Act, Protocol 2003. Cigarettes and other tobacco products prohibition of advertisement and regulation of trade and commerce, production, supply and distribution Act was enacted in the year 2003. The Act is applicable to all products containing tobacco in any form. Maybe it is being used as bidis or cigarettes, or other form of pastes that is popularly used as for cleaning of teeth. That is another myth that many people feel that once tobacco pastes are used, that their dental hygiene will be maintained. The objective of Tobacco and Other Products Act 2003 is to discourage tobacco use in any form, protect the youth and masses from harmful effects of tobacco uses and second-hand smoke exposure. The specific provisions made under the Act include prohibition of smoking in public places. Number 2, prohibition of direct and indirect advertisement, promotion, and sponsorship of cigarettes and other products. Prohibition of sale of cigarettes and other tobacco products to a person below the age of 18 years. And this is effective from August 2011. Prohibition of sales of tobacco products within a radius of 100 yards of educational institutions. Mandatory depiction of statutory warning, including pictorial warnings on tobacco packs. And the picture clearly says that smoking kills. So this is educational mandatory warning that is given on cigarette packs so that people can read it, and 3 sets of graphic warnings each for smoking and smokeless chewing forms are to be displayed on the packs. Display of tar and nicotine contents on tobacco packs along with maximum permissible limits. Restriction of depiction of tobacco uses in films and televisions. Films showing tobacco product or their use shall also be required to display an anti-tobacco health warning on them in the form of a static message during the period of display of the tobacco product or their use in the films, in addition to health, sports and disclaimers. National Tobacco Control Program has been launched in India with the objectives to bring about greater awareness about the harmful effect of tobacco use and tobacco control laws. To facilitate effective implementation of tobacco control laws, this National Tuberculosis Control Program has adopted all the 3 proven strategies for controlling any problem in public health. This enforces legislative measures. This provides service mechanisms so that tobacco control can be reduced, and it also emphasizes on educational approaches so that combination of the 3 approaches will give optimum dividends. It is National Tuberculosis Control Program is 100% centrally sponsored program. Presently under implementation in 21 states covering 42 districts, 2 districts per state. And the idea is that this has to be scaled up over a period of time. Organizational structure for NT National Tuberculosis Control Program at national level, we have National Tobacco Control Cell. This National Tobacco Control Cell program in charge is Joint Secretary or Director from Ministry of Health and Family Welfare offices. Consultants are officers from Directorate General of Health Services. Consultants from other fields like policy, legal instrument, national coordination, information education, and advocacy. At national level, we have an inter-ministerial task force. Chairman is Secretary Health, and members comprise of representatives from 12 departments of Government of India, special invited 7 state governments and 2 civil society representatives. At national level, there is a steering committee. Chairperson is Secretary Health. Members are representatives from 3 departments of Government of India, very closely associated departments like Industry, Information Department, and so on, and Health Department. Representatives from 3 departments of Government of India, along with representatives from Press Information Bureau, Advertising Standards Council of India, and civil society organizations. Organizational structure of National Tuberculosis Control Program at a state level includes State Tobacco Control Cell. State Tobacco Control Cell has a state nodal officer who is a senior officer from the State Department of Health. State level, there is a state level coordination committee which is headed by Chief Secretary or his nominee, and Member Secretary is Principal Secretary, Secretary Health. At district level, we have District Tobacco Control Cell, DTCC. The district nodal officer is preferably Chief Medical Officer, Civil Surgeon on full-time basis. And district level coordination committee comprises of Chairman, Collector or District Magistrate of the district, Member Secretary, District Nodal Officer, and members from other different sectors. Enforcement squad is there, preferably which works under the guidance of. At block level, we have block level coordination committee. Convener is block level. The block level coordination committee is medical officer in charge of the block primary health center, and members are block panchayat members, gram pradhans, block level government officers from other various departments, non-governmental organizations, and local MLAs and MPs of that particular area. At village level, we have village level committee. Chairperson is village head, pradhan, school teacher. Village members are village panchayat secretary, health worker female, accredited social health activist, Anganwadi worker, 2 to 3 members of the village panchayat, and alternatively the existing village health sanitation committee, which is likely to be converted into participatory councils, may be used. This village level committee has a lot of responsibilities in creating awareness about anti-tobacco moves and educational campaigns. Activities of National Tuberculosis Control Program. The National Tobacco Control Cell. At the national level, it has certain responsibilities. At the national level, public awareness campaigns are organized by them, and they decide the critical messages that has to be conveyed to the people, and also the particularly emphasizing on mass media and also other legislative and service approach measures that has to be taken. The National Tobacco Control Cell is also responsible for setting up the tobacco product testing laboratories. This cell also coordinates research on alternative cross-livelihood of tobacco growers and workers, because it is often said that the economy generated by the tobacco industry is quite large, and farmers and growers and workers involved in that, they must be provided an opportunity or alternative mechanisms for livelihood. Monitoring and evaluation is an important activity that is carried out by the National Tobacco Control Cell, and this cell also attempts to integrate National Tuberculosis Control Program with other programs in the convergence mode. Activities of District Tuberculosis Control Program. The first and foremost activity of the District Tuberculosis Control Program is training and capacity building of the relevant stakeholders. It is realized that tobacco control cannot be achieved by a single department. Multi-sectoral linkages are required, and all stakeholders which are involved in the process of tobacco control must be trained enough, and they must have a strong capacity to empower people, to educate people about the harms of tobacco products, and also ensure that the tobacco control legislative mechanisms are brought into under the overall umbrella of the tobacco control program. School awareness program is desired. School awareness programs have a lot of potential because school children are available at one place, so larger outreach can be ensured. They are the young people who catch up these problems, consumption of bidis, cigarettes. They usually picked up these habits at a younger age, and young children, particularly who are in schools, it has been observed that they directly pass message to their family members. They can be a role model in educating people. When their parents, they can enforce their parents to leave tobacco products in any form once they understand the importance of that. So school awareness building programs, school program is a very critical input for tobacco control initiatives. Setting up an expansion of tobacco cessation facilities by setting up tobacco cessation centers, because if some person is willing to leave tobacco, then necessary support has to be extended. Alternative mechanisms must be in the go. So tobacco cessation centers are required for that purpose. Information, education, and communication or media campaigns are desired to inform people about the ill effects of tobacco, harmful effects of tobacco, and the associated diseases, particularly cancer, hypertension, and so on. Tobacco can lead to many diseases. Monitoring and enforcement of tobacco control law is also a responsibility. The block level coordination committee, convening the block level development coordination meetings twice a year with tobacco control as a special agenda. Orientation and sensitization by elected representatives and officials about the ill effects of tobacco, and IEC media campaigns in the area, working towards tobacco-free schools and offices in their block. So at least workplaces and school premises should be free from tobacco consumption, and that will motivate others to do that. Activities at village level, developing an annual village action plan to make tobacco-free village. This can be taken up by participatory councils or sanitation and health committees that are in sensitization of village level officials and village level workers about the ill effects of tobacco. Information, education, and communication campaigns involving school children, and reporting violations of Cigarette and Other Tobacco Products Act. Developing tobacco control volunteers in every village. They will act as a change agent, utilizing common service facility for anti-tobacco activities like accessing information on tobacco control, downloading IC materials, forms, and so on. A number of international and national organizations are helping in this endeavor. WHO, But the World Health Organization had taken a very important lead. They have framed global framework. They have also evolved targets for monitoring in this area. Then Public Health Foundation of India is another organization. Voluntary Health Associations of India are working in this group. World Lung Foundation, because particularly respiratory diseases caused by when lung cancers of oral cavity and so on. So World Lung Foundation is involved in this, and International Union Against Tuberculosis and Lung Disease are also involved in this process. So if you look at that, tobacco is used in various forms. As you see, that is smoking of tobacco, bidi smoking, cigarette smoking is quite common in the country. Tobacco is used in other forms in the form of canning. It is very popular in our country that tobacco is consumed along with lime, and that leads to oral and esophageal cancers to a long run. Smoking in any form leads to lung cancers, and smoking is also related to various types of diseases like hypertension, and is also sometimes lead to other reproductive problems and so on and so forth. So once realizing the fact that tobacco consumption is a serious problem in our country, Government of India has, along with the inputs provided by WHO, has taken this on a priority basis and started National Tobacco Control Program. The program is based on the three important principles of public health. One is creating legislation and developing a mechanism so that legislative approaches are taken care of. And second is providing certain measures, so certain service provisions so that tobacco consumption is brought to a lower level. And last but not least, educating people about the harmful effect of tobacco and promoting behavioral change in them through information, education, and communication campaigns, and also establishing mechanisms which will enforce that all legislative measures, all legislative provisions provided in the Tobacco and other Tobacco Farm Act, so that tobacco control is brought to the minimum, and the adverse effects of or the diseases caused by these products can be brought to a very, very lower level. Now, it has been rightly said by someone that it is easier to destroy a nation than habits, and this is true for tobacco use also. If you want to insist on tobacco restriction in the community, then certain value-added educational system has to be evolved, and people should be made aware. Those who are involved in the tobacco production, alternative mechanisms must be thought for them, because tobacco industry is giving some economy, giving some livelihood to some people, and unless alternative provisions are made, probably the initiatives will not pay as much as dividend as it is desired. So in nutshell, that we can conclude that a lot of initiatives have been taken this and by the government. Mechanisms for anti-tobacco drive has been it is in place, but however the decisions are taken by individuals, and in the lifestyle modification, tobacco control is the most important input, and it will bring out considerable reduction in non-communicable diseases and including cancer. So government has rightly instituted this program, but many things has to be done to get optimum dividends in this area. I would like to share some audio-visual clips that will make us understand various initiatives taken by Government of India to curb the menace of the tobacco, particularly the educational approaches.
Lungs are like sponges designed to soak up air, but some people use their lungs to soak up cigarette smoke. If you could wring out the cancer-producing tar that goes into the lungs of a pack-a-day smoker every year, this is how much you'd get. It's enough to make you sick. Very sick.
खुशी कौन नहीं चाहता, लेकिन किस कीमत पर? धूम्रपान महंगा पड़ता है। धूम्रपान आपके लिए हानिकारक है और आपके चाहने वालों के लिए भी। धूम्रपान पड़ेगा महंगा।
Just now you have seen two video clips. The first video clips is showing us that a person starts smoking and he has persistent cough. And he often coughs and family members are annoyed on that part. And that is the story we see in many families. To start with, family members say that stop smoking, it is not good for health, and so on and so forth. But the person never realizes unless the disease is advanced. And tobacco, along with tobacco smoking, bidi smoking is quite common in our country. And when the disease turns to cancer of oral cavity or pharynx or lung and ultimately leads to death, then people understand the importance that what the damage is caused by smoking. Classically, I can narrate a story that a person is looking at the advertisement, smoking is injurious to health. On the next page, we are seeing that the same young person is taking a puff of cigarette and he says that who cares? It means that unless the health is completely jeopardized, people don't attach importance. And once a case of tobacco-induced cancer occurs in a family, then they realize tobacco kills. Tobacco is a significant contributor to mortality, premature mortality due to cancer. And therefore, this menace has to be stopped. Tobacco in other forms, like use of canny, that is a tobacco powder is used as a lime, that is also responsible for many types of cancers. In fact, tobacco can lead to any type of disease. The second clip emphasizes that the smoking is prolonged. Each year, a lot of tar is deposited in the lungs. It reduces the lung capacity, the vital capacity of the lungs, and ultimately leads to chronic obstructive lung disease besides cancer. So, functional ability of the person is jeopardized. Though the common myth, as I have said earlier, is that smoking enhances concentration, smoking enhances power for doing a particular job. It is not the truth. If it is continued for some years, ultimately the physical vital capacity of a particular person is reduced. So smoking is not beneficial, or consumption of tobacco in any form is not beneficial either in terms of mortality or in terms of optimum health. So one should understand that this menace of tobacco consumption in any form should be stopped. Why? Because it affects the productivity of a particular person. And ultimately, if tobacco-related cancer occurs in a family, the person is put in a very jeopardized condition. Entire families is in the catastrophe, and many times people sell their assets and to take care of a patient. And ultimately, if the case is not detected early, if the reversal trend is not observed, the death may occur at any time. And Therefore, tobacco consumption has to be curbed, and the three public health approaches, legislative approaches, service approaches, educational approaches have been brought under the ambit of National Tobacco Control Program. However, there is a market promotional activities in this regard, and that has to be also taken care of, that people must be made aware ill effects of these products, so that, and also a social pressure must be created in this regard, so that the menace of tobacco consumption be curbed as early as possible. Thank you very much for visiting EPG Pathshala.